Dr. Ungerleider is an internal medicine physician at the California Pacific Medical Center. So, Dr. Ungerleider, I mean, looking at the numbers as of this morning, 67% of adults have received at least one dose, 58% of adults fully vaccinated. That's according to the CDC, again, falling short of the stated goal of 70%. But, I mean, do you see reason to celebrate where we are in this pandemic?
Craig, we certainly have a lot to celebrate. Remembering what was happening 1 year ago, we weren't sure if there was going to be a COVID vaccine in 5 or even 10 years. So the fact that we have several effective and safe vaccines is truly remarkable. The fact that 67% of adult Americans have gotten either their first dose of an mRNA vaccine or one Johnson & Johnson shot in just a few months' time is a major accomplishment, and it puts all of us in such a better place in this fight. But there's a lot more work to do in the over 1,000 counties in the U.S., mostly the Southeast and Midwest, with vaccination coverage of less than 30%. The Delta variant, which is much more infectious and may cause more severe illness, is taking off in those places. So, in these locales, we may likely see large spikes in new cases in the weeks ahead, and the unvaccinated are at very, very high risk. Now, because we have enough people vaccinated across the country, and these vaccines are effective against variants, including Delta, a national surge is unlikely, as we've been talking about, but there will be regional surges. So we shouldn't declare victory too early here.
Dr. Ungerleider, President Biden acknowledged in those remarks the challenges posed by that Delta variant, which now accounts for more than a quarter of cases in this country. Is that the greatest concern right now, that Delta variant?
Yeah, Craig, it's very contagious, and it's quickly on its way to becoming the dominant variant in the entire United States, like it has in the UK and other countries. And while we know that fully vaccinated people who get infected with Delta, they do tend to have milder symptoms, people who are only partially vaccinated, and certainly the unvaccinated, are at very high risk. So right now, what we have to do is prioritize equity in vaccine distribution, especially in the areas that we know have low vaccine uptake. I think right now we have to do everything that we can to prevent any avoidable suffering and death.
Dr. Ungerleider, I mean, we have literally gone door to door with the vaccine in some communities in this country, pop-up vaccination sites all over America. The vaccine is widely available to anyone who wants it. At what point do we say, okay, well, that's it. We've tried, we've made every effort. If folks who don't want to get vaccinated just can't be persuaded or convinced to get vaccinated?
Well, Craig, I'm not sure it's that simple. And I think that because we have safe and effective vaccines that can save lives, we have to continue doing everything we can to encourage people who are skeptical or who have questions to do so. We know that in communities with low vaccination rates, transmission of this virus is just as high as it was at the peak in January. So again, for people who are unvaccinated, the risk of getting, COVID, getting potentially very sick is very, very high. And I think we can't stress that enough for people. We know that nearly all the deaths in this country due to coronavirus are now in the unvaccinated. So we have to press forward, make sure we're figuring out how to get the message to vaccinate the most vulnerable among us. And of course, for people who are vaccinated, that's fantastic. Continue to encourage people that to get their shots. So I think this is on all of us to protect the vulnerable, our children, and people across the world who've not yet had the opportunity to get a vaccine.
Dr. Shoshana Ungerleider on this Monday. Dr. Ungerleider, thanks as always.